Hi guys, and welcome back. In this video, we're going to talk about the anatomy of the pharynx. So when you think about the pharynx, remember that it's basically a fibromuscular structure. It's a cavity that lies behind the nose and mouth. It's basically a common passage for the air and food. And as we proceed down, we will whether decide to take the air to the lungs and breathe, or the food to the esophagus at the level of C6 and take it as food and continue our path to the digestive system. Why do we call it a fibromuscular structure? Because it's mainly formed by the fibrous layers and the muscular layers, and that is lined by mucus layer and covered by pharyngeal aponeurosis. So when we say it's a fibromuscular, because it's a structure that is formed by the buccopharyngeal fascia, followed by your muscular layers. We have longitudinal layers, muscles, and circular muscles. And then this fibromuscular structure is lined by mucus layer and covered by pharyngeal aponeurosis. And that aponeurosis is basically the flat midline tendon into which your pharyngeal muscles are going to attach. All right. Now let's take a closer look at the pharynx parts. So we have nasopharynx, and that is basically the cavity that lies behind your nasal cavity. All right, and then you have the oropharynx, which is basically the cavity that lies behind your oral cavity, and then you have the laryngopharynx, which is the part that lies behind your larynx. All right, so you have the nasopharynx, the oropharynx, and then the laryngopharynx. If your air decides to go to the larynx and breathe inside here, it means this is going to continue in the respiratory system. But in that digestive system, we are going to continue backwards towards the esophagus. This is an open part getting into the esophagus because this is digestive system, and we will decide to move in this path to see what's gonna happen with the food. So again, behind to your nasal cavity is your nasopharynx, behind to your oral cavity is your oropharynx, and then down to your laryngeal inlet and epiglottis part of the larynx behind, this is your laryngeo pharynx. This is basically pharynx that is posterior to the larynx. Okay, these are how we are giving the names. And then at the level of C6, we are going to start the esophagus. All right. Now, what are the boundaries of each part of the pharynx? When you think about the nasal part, all right, nasopharynx, of course, you are posterior to the nasal cavity. So what would be your roof? You guys look at this, closer look. Your roof is going to be the base of the skull. It's basically going to be the sphenoid bone. So if you guys look at this picture, this is your nose, this is your nasopharynx, in the up part here, you have your body of sphenoid bone. And if that is the body of sphenoid, it means here you have the pharyngeal tonsil. All right. Now, what's going to be your floor? Of course, you guys, I told you that the nasopharynx starts here, and your soft palate is going to demarcate the nasopharynx from oropharynx. So, of course, your floor is going to be the soft palate, because the soft palate is the muscular structure, like we said in the previous video, that is, if it contracts, is going to seal off and closes off the nasal cavity and prevents the food from getting here. So of course the floor of nasopharynx is your soft palate, right? Now what about the lateral wall? The lateral wall, if you think about it, think about your ear, of course, because there is a communication between your middle ear cavity and the nasopharynx, and thanks to this communication, because it helps to equalize pressure. Remember that if you go up mountains or in the airplanes, there will be change in the pressure on the two sides, the atmospheric pressure and the pressure inside your body. So although this canal, the auditory tube, is closed normally, but if there is change in that, all right, there will be, as you yawn or try to chew something, and you try to contract the muscles around the cartilaginous part of your auditory tube, which is the salpingiopalatine and salpingopharyngeal, you're going to open the canal to equalize the pressure. So if that is your nasopharynx, this is what communicates. This is the opening. It's basically closed at this point. It is communicating with the middle ear cavity by the auditory tube. So once we say nasopharynx, lateral wall, remember stuff related to your ear. And because this is the cartilaginous part of auditory tube, remember that we have two folds. Remember the same concept even in the oropharynx. Here you have two folds, one back and one front. So the front is facing the palate. So this is salpingio-palatine, because salpingio in Latin means tube. And from the tube, from the cartilaginous part of the auditory tube, you have another muscle covered by another mucosal lining. So we call it fold. And this is salpingio-pharyngeal fold. All right. And then in the medial part of the cartilaginous part of auditory tube, you have your tubal tonsil. All right. So when we talk about the nasopharynx, remember that you have important folds from the tubal elevation, one into the front and one to the back, the salpingio-palatine and salpingio-pharyngeal, all right, and your tubal tonsil, because we need defense system, because these are parts of the body that are communicating with the surrounding environment. So we need those tonsils to defend our bodies against the pathogens, okay? And also remember that this pathway or this passage is actually very critical and important in transmission of these pathogens. That's why sometimes if someone has cold or flu and it doesn't get treated well, the bacteria can migrate through the canal and get into the middle ear cavity and cause otitis media. So that's why, it's because usually if we have cold and flu, that's going to affect everything around the mouth, the throat and nose. But in the nasopharynx, there is a communication through the auditory tube here to the middle ear, so the pathogens can go inside and cause infection. Now, the next part is basically the oropharynx, and the oropharynx is posterior to the oral cavity, and it's bounded superiorly by the soft palate, of course, and it's bounded inferiorly by the posterior part of your tongue, because your tongue is down here. Now, what about the lateral wall? You guys think about the oropharynx exactly the way you think about the nasopharynx. You have also two folds, and these folds are coming from the palate, the soft palate, to the structure at the back and to the structure to the front. So we're gonna call it the palatoglossal and palatopharyngeal folds, and they are the mucosal lining above the muscles. So I have palatoglossals and palatopharyngeal muscles, and between them the palatine tonsil. All right, this is the same concept of the nasopharynx. There we have salpingio, here we have palato, and also there we have tubal tonsil, and here we have tonsil. So this is how you will remember the lateral wall of both of them. All right. Moving on, we have the last part of the pharynx, which is basically your laryngopharynx. And how do you know the boundaries? Of course, your roof is going to be the epiglottis, because this is what closes off here and demarcates the oral part from the laryngeal part. So above you have the epiglottis, and the floor down is basically your coracoid cartilage. I cannot see it. Coracoid cartilage is down here. All right. Why this is down? Because it means that this is the end of the laryngopharynx. Now, what will happen on the lateral wall? If you look, guys, at the lateral wall, you will find the thyroid cartilage at here laterally. This is thyroid cartilage outside, and this is a fossa, which is very important. This is the pyriform fossa. We're going to talk about the clinical note in a while. All right. So if you guys look here, remember the laryngopharynx, the lateral wall was the thyroid, and the pyriform fossa was here. Can you guys see that? This is the thyroid cartilage, and this is the fossa itself. It's on either side of the laryngeal inlet here. This is the lateral wall of the laryngopharynx. Now, what are the muscles of pharynx? Muscles of pharynx, we have three inner longitudinal muscles and three outer circular muscles. The inner longitudinal, we need to remember some soldiers here as well, because we need some attachments. Two of them, just like the previous video, which is from the palate and styloid process, and one of them from the salpingio, which is the auditory tube, because I need muscle that's related to the nasopharynx. So what are the three longitudinal muscles? One from the tubal cartilaginous part of auditory tube, one from the styloid process, and one from the soft palate. So what are these muscles? Let's try to say them as they go from that soldier to my structure. All right, so one is the salpingopharynx, one from the soft palate, so palatopharyngeus. All right, salpingopharyngeus. Sorry, I'm talking about salpingio, a muscle going to the pharynx. Salpingopharyngeus, all right? One from the soft palate, which is palatopharyngeus, and the last one from the styloid process, which is the stylopharyngeus muscle. These are the outer muscles of the inner longitudinal muscles, sorry. And then outside, I'm surrounding them by three muscles. One superior, one middle, and it's very thin, and one inferior, which is bigger one. Now, what are these muscles? From where they are coming? One that comes from the medial pterygoid plate and the pharyngeal raphe. It goes all the way to a midline pharyngeal aponeurosis here. It blends in the midline. So this is the superior constrictor. The next one, very thin muscle coming from the hyoid bone. This is the middle constrictor, and then I have inferior constrictor that comes from these two cartilages. They are very important cartilages in the respiratory system of your larynx. These are the thyroid cartilage and cricoid cartilage. So the inferior constrictor has two parts coming from the thyroid and cricoid. So we call them thyropharyngeus and cricopharyngeus. All right, so these are the three muscles. All of them, they will come posteriorly in the midline and attached to the pharyngeal aponeurosis here. All right, so we have superior constrictor, all right, related to the mouth and the medial pterygoid plate, all right, and the one coming from hyoid bone, middle constrictor, and the down one from the thyroid cartilage and cricoid cartilage, and they are important, and we will see now why. So what about the motor innervation of the muscles? All of the muscles of pharynx are supplied by pharyngeal plexus of vagus nerve except the stylopharyngeus muscle. How will you remember that? Remember that the stylish girls like to wear lip gloss. So the stylopharyngeus muscle is supplied by glossopharyngeal nerve, and everything else is supplied by pharyngeal plexus of vagus. Remember also previously when we talked about the palate, all muscles of palate were supplied also by cranial accessory of vagus, except the tens, the QT palate, one of the two palate sister, okay? The tensor palati, it's supplied by mandibular nerve, okay? Great. Now we have important structures that pass through between these muscles, okay? How will you remember them? Now you have, first of all, boundaries. We have borders, and between them you have structures passing through, okay? You have your base of the skull, which is basically here. You have your superior constrictor here. You have middle constrictor here, and you have inferior constrictor here. How will you remember the structures? I want you guys to know them from down to up. Now, first thing is your inferior constrictor muscle, all right? Above that, you have, of course, the inferior constrictor is attached to the thyroid and cricoid, and these are cartilages of your larynx, okay? So these are stuff related to the larynx. If I am above the inferior constrictor, so the structure that passes between, let's say above the inferior constrictor, is going to be superior laryngeal nerve and vessels. If it's inferior, it's going to be inferior laryngeal nerve and vessels. But remember, one thing is that there is one branch that passes above the inferior constrictor, which is the internal laryngeal branch. It's not the whole superior laryngeal. But this is how you will remember how to memorize it. So what passes between the middle and inferior constrictor, it means what passes above or superior to the inferior constrictor, it's basically the superior laryngeal nerve and vessels. Inferior to that is inferior laryngeal nerve and vessels. This is the first thing I will help you to remember. Okay, so we are done with down. Let's go up a little bit. So what would pass here between the superior and middle? So superior girls are the stylish girls who wear lip gloss. So what runs between the superior constrictor and middle is the stylopharyngeus muscle and glossopharyngeal nerve. All right. Now the last thing is that are the things related to the palate, because actually what's up here is basically the palate. So what passes through between the base of the skull and superior constrictor is the levator palatine muscle, the ascending palatine nerve, palatine branch of ascending pharyngeal nerve. So remember, if you are down here on the inferior constrictor, superior, stuff related to the larynx, superior and inferior, and then superior girls are the stylish girls, and then the most above thing is stuff related to the palate. All right, and here is the stylish lady, and then here stuff related to the larynx, which is basically superior laryngeal nerve and vessels and inferior laryngeal nerve and vessels. All right. Now, what would be the clinical notes? You guys need to know that the pyriform fossa, like we said previously, it's a fossa on either sides of the laryngeal inlet. It's important because the internal laryngeal nerve, as it pierces the thyrohyoid membrane, because it wants to reach the larynx and supply structures in the larynx, it has to come through the pyriform fossa. So it's a common area of lodging of food, like the fish bone, and there could be any injury here. And if that happens, the internal laryngeal nerve is going to be at risk. Another important clinical note is that, like I said previously, you guys remember that I told you the inferior constrictor has two parts, one attached to the thyroid and one attached to the coracoid. So the thyropharyngeus muscle and cricopharyngeus muscle, they are different parts. And because they get their innervation from the pharyngeal plexus, and the cricopharyngeus gets extra innervation from recurrent laryngeal nerve. So there could be this coordination between these two types of fibers. And if that happens, because you guys think about you're trying to swallow a food, in order for the food to come down, you need to contract this and relax the down muscle. If the down muscle does not relax, this will cause both of them to be contracted, and then the food is going to push this defect, the area here, pushing the mucosal lining with the lines that are previous to the muscle itself back, causing a pharyngeal diverticulum, and this is what they call Kilians dehiscence. The reason is why because there could be this coordination between the two parts of the inferior constrictor, which are the thyropharyngeus and cricopharyngeus muscle, and that discoordination ends up preventing the cricopharyngeus from relaxing. It should relax in order for the food to pass to the esophagus. But if it does not, then that is going to cause bulging of the inner lining of the pharynx and causing what we call the pharyngeal diverticulum. Now, for the blood supply, it's very simple and easy. Like we said previously, you guys know that the maxillary artery, which is a terminal branch of external carotid, this is your external carotid. You guys look at that. It ends in the substance of parotid gland into maxillary and superficial temporal. And you guys can see that the maxillary is giving a lot of pharyngeal branches to the pharynx, okay? There is another thing, it's basically, remember when I told you in the previous video, if you think about the external carotid, it has anteriorly 3 branches. It ends up as 2 terminal, which is maxillary and superficial temporal, okay? And there is one artery that comes from the external carotid artery itself, that is the ascending pharyngeal, because the name is ascending pharyngeal, so it makes sense that it gives supply to the pharynx, okay? So maxillary gives pharyngeal branches, ascending pharyngeal gives supply to the pharynx, and also from the facial. Remember that here we had the superior thyroid, and then we had lingual, and then facial. So from facial, there is ascending palatine. It also gives blood supply. So we have um, pharyngeal pharyngeal branches from the maxillary, all right, and it makes sense, and also from the facial nerve, which is a branch of external carotid. Also, it gives ascending palatine. Also, it gives ascending palatine artery, and also, of course, we have the ascending pharyngeal. All right, from the name, it's a branch of external carotid that also gives. So ascending pharyngeal, ascending palatine, and pharyngeal branches of maxillary. All right, this is basically branch of external carotid. So from external carotid, from the facial, from maxillary, we have branches like we just here draw. From the external carotid, you have ascending pharyngeal. From the facial, we have the ascending palatine, and from maxillary, you have branches as well. And for the venous drainage, we have pharyngeal plexus, and those pharyngeal plexus, if you guys look at the internal jugular vein, this is your internal jugular vein, and this is your facial vein, comes from the face and drains into internal jugular. So the pharyngeal venous plexus, all right, it drains into the facial vein, all right, and it also drains into the internal jugular vein. So these are all pharyngeal plexus of veins. They drain into the facial, and they also drain into the internal jugular eventually. Some of them, they go to the internal jugular, and some of them, they go through the common facial vein. All right. So I hope you guys grasp the concept, and thanks for watching. Don't forget to like and subscribe and watch the next videos.